Nearly 304 million people live in the United States of America. How many of these people should have access to health care? 47 million people do not have health insurance. 30% of young adults are uninsured. 1 in 10 U.S. citizens between the ages of 18 and 64 cannot afford necessary prescription drugs. 10% of U.S. citizens must delay receiving needed care due to cost. 1 in 10 U.S. citizens 45 to 64 years old have no insurance. 50% of them will be diagnosed with high blood pressure, serious heart conditions, diabetes. Every 30 seconds, someone in the U.S. files for bankruptcy due to medical debt. The quality of the U.S. healthcare system is ranked 37th in the world. Every year, 7 out of 1,000 babies die in the U.S. at birth. 101,000 people die each year because of lack of necessary medical procedures in the U.S. The United States of America is the only industrialized country in the world that does not provide universal insurance to its residents. We know this is a problem, but what is the solution?
Protect the people! Government is supposed to protect the people! Not the corporations! Not the corporations!
It is long overdue for us to recognize that healthcare is as much a basic human right as education and police and fire protection and having the street plowed when it snows. And we don't expect people to pay a deductible to send their kids to public school or to have the fire department come when their house is burning. And it's time for New York to join just about all of the rest of the industrial world and have a universal system of paying for health care for rich and poor alike that we don't pay for out of pocket, but is paid for by broad-based financing based on ability to pay. That's what a civilized country ought to do. And, you know, I read the papers. I understand that at the federal level, we're not quite ready for such sensible national policy. But fortunately, in this country, we have individual states whose politics is way out in front of the federal government. This bill would move New York to a fully spelled out and funded single-payer system. It would be a system in which there would be payment for primary care practitioners to help you coordinate your care, not as a gatekeeper, but as an access point to the care that you need and someone to help you take advantage of all of the care that you need. There would be no more premiums or deductibles or co-payments. The system would be paid for fairly by broad-based taxes based on ability to pay. Every New Yorker would be entitled to what every human being ought to be entitled to, which is full health care, so we can all live better and longer and happier lives. Thank you.
I'm Scott Marsland, and I live in Ithaca, New York. I've been an emergency nurse for the last 7 years, and I've been a nurse for 15 years. And my story is one of going to work every day and meeting people who don't have insurance and seeing how that affects their ability to get the care that they need. The bottom line is that people who don't have insurance wait longer to come to the emergency department. So when they get to us, they're much sicker, and it takes a lot more resource to help them get back to their baseline. And I meet lots of people who are middle-class working people who either don't have insurance or they have insurance and they can't afford the co-pays and the accumulating bills. And so they put off getting health care. I met a man who was actively having a heart attack who left the emergency department because he knew he wasn't going to be able to afford to pay the bills. and he didn't want his family to get stuck with the bills. So my experience raises the question of whether or not we as a nation believe that people deserve to die because they don't have health care. It's a moral question that every other industrialized nation in the world has answered yes. Are we ready to change our answer?
What we really need is a much more efficient kind of health insurance, and that's a national health insurance. You spread the risk among the whole society, and you lower the cost for everybody.
My name is Ann Furman. I live in Trumansburg, New York, and my story is about my oldest son. And while there's no way of really being sure how you can predict somebody's behavior, a good rule of thumb is how did they act in the past will predict how they would act in the future. When my son lived on the West Coast, he worked for a marine insurance company, and he had healthcare insurance. When he got sick, he didn't go to the doctor because he had high pain tolerance. And he got sicker, and he didn't go to the doctor because he doesn't like going to the doctors. And he got even sicker, ended up in the emergency room because he had healthcare insurance, and he was operated on with an emergency appendectomy. And within a week, he was well and back at work again. After my husband died, my son moved to Trumansburg, New York to help me, and I did need help. And he was working full-time at Cornell in the admissions department. And it was a job that ran from October to May. And Cornell called that a temporary job, and there was no health care insurance. When he got sick, he didn't go to the doctor because he had a high pain tolerance. And he got sicker, and he didn't go to the doctor because he didn't like going to the doctor. And when he got even sicker, he still didn't go to the doctor because he had no health care insurance. And when he was very, very sick, he ended up in the emergency room, and he died 19 days later of sepsis. My son, I regard as one of the 45,000 people who die every year because they lack health care insurance.
There is something absolutely wrong about a system where people die because they can't afford the type of health care that, as a country, we can provide them. Now, these Americans who are without health insurance, they are not bad people who should be punished. They're mostly working people. They just don't earn enough or have good enough jobs to have health insurance. And for that, they don't get to go to the doctor. We are a rich country, and that's what we offer people. Working people, hard-working people with children. We offer that to their children because as a society, we're letting the for-profit motives of insurance companies drive the type of health care. From my way of looking at things, from my morality, that is fundamentally wrong. I mean, other people may have a different morality that says it's okay to let people die when you can do something about it. But I think it's wrong.
My name is Demetria Jackson, and I live in Binghamton, New York. I am currently a dental hygiene student, but I don't have dental coverage or health coverage at this point. With the economy and, with me going to school full-time, I don't work full-time, and working part-time, you usually can't get benefits on the job. And at times I experience pain on my left side, my 2 wisdom teeth. I think I need to get them extracted, but due to not having any coverage, I can't afford to get them extracted. So I just deal with the pain that they cause. It usually gets worse during the colder months when the weather changes. But unfortunately, I fall into that category of citizens who just don't have the coverage and can't afford it. I wish that healthcare was more readily available, dental care was more readily available to more people in society who could really benefit from it and who really need the care. It shouldn't be based on your income or, you know, your job status, because, you know, just because I don't work full time doesn't mean that I shouldn't be able to access the care that someone who goes out and works 40 hours a week. You know, I am in school to get an education so that I can get a career and work and be a benefit to society. But, you know, for now, I'm just dealing with it, and hopefully down the road, we can see some changes for the better for health coverage, for dental coverage, for everyone who really, really needs it.
45 million Americans don't have insurance. Another 25 million have insurance that is really inadequate in case you actually get sick. 45 countries in the world have longer life expectancy than people in the United States, including Cuba, including all the Europeans. And yet we're spending way more.
My name is Jennifer Gemmel, and I live in Ithaca, New York, and I'd like to talk about the healthcare system in England, where I lived for 9 years, and compare it with the system here. I moved to England with my husband and my son in 2003, and a few years later my husband came down with pancreatic cancer. And we were very, very happy with the care he received there. He woke up yellow one morning and knew there was something wrong. They had him in for tests almost immediately. And when he was diagnosed with cancer, a short while after that, he was undergoing surgery very quickly. There was no waiting period. The surgery itself lasted for 9 hours. All of that was paid for. His medications were all paid for. He survived the cancer for 4 years. And during that time, absolutely everything was paid for. While we were there also, my son became ill, and he was hospitalized for, 3 different times, on 3 different occasions. He was hospitalized for weeks at a time. And his health care also was paid for. I think that health care is a right, not a luxury that the wealthy should be able to afford, or people that have good jobs. I think everyone needs health care, just like fire protection, just like police protection. And I believe that it should not be profit driven, that it should be determined by what's best for the patient and not what's going to earn the hospital the most money. I feel that health care should be free.
My name is Kathy Morris. I live in Newfield, New York, and in 2005 I had back surgery, and this is the book that I ended up creating about that experience. It's called Spinal Diary: Back Surgery and Creativity in the Age of the Uninsured. So as a freelance artist, I have pretty much always been uninsured, and I've always taken care of myself. I'm a very independent person, and I've also always been very health oriented. I've been a yoga teacher for many years. I take care of my diet. I'm a very strong, healthy, independent person, and I just hoped that I would make it through to age 65 and Medicare. And at age 56, I got caught. I had a back injury, and it just kept getting worse. Essentially, I was in pain for 7 months, and all the medical practitioners kept saying MRI, and I kept saying I can't afford it. And at a certain point, it was no longer a choice. It was a crisis. I got the MRI, and they said, surgery now. I had the surgery. I had a wonderful surgeon. The hospital was fantastic, and I healed wonderfully, and I was stuck with $15,000 worth of medical bills. So because I am a middle-class person in terms of my education and my ability to deal with the world, although I'm not middle class in terms of my income, I was able, with the help of friends and the community, to negotiate with all the various medical practitioners and the offices and whatnot on my own, and I was able to bring the bills down to a manageable amount, and over time, by paying off monthly, I was able to come out from under that debt. I think I'm an exception, And I think it's absurd to have a medical system in this country that's based on an exception. The idea that people like me can handle this kind of thing. Well, I can, and I did, but that's not how things should be run.
I'm Susan Soberoff. I'm a family doctor, and I practiced in Trumansburg, New York for 30 years. And during the time that I practiced, I saw a huge change in how I did healthcare, because the private healthcare insurance industry took over so much of our practice that basically by the time I left my practice several years ago, the insurance companies were making many of the medical decisions that I should have made. And this led to a great deal of confusion and I would say not very good medical practice. Even people who had insurance, which is largely the folks that we saw in our practice, didn't have the coverage that they needed. For example, a young soccer player came in with a very bad knee injury, and his surgery was delayed because the insurance company would not cover even the MRI in a timely fashion. And that meant that he didn't have surgery on time and has a permanent disability of his knee. When I left my practice, I started working at the Ithaca Free Clinic, which is one of a few places that will see people who have no health insurance for nothing. And there are many examples of people who I've seen there who really needed care. But one who comes to mind is a young man who was very ill with Lyme disease and was able to get free care for something that might have cost him hundreds of dollars if he had gone to the emergency room. Other people we see there have serious illness and really should be seeing doctors on a regular basis, people with heart disease and diabetes, high blood pressure. So we really can't delay anymore. We have to provide good health care to everybody who needs it.
With the incredible drive toward extracting profits from caregiving that we're in, you know, a funny thing starts to happen because the act of caregiving isn't something that lends itself to profit making. The act of caregiving is an act of solidarity, and I would like to define solidarity the way that the general practitioner from Wales, Julian Tudor Hart, did, which is solidarity is not altruism. It's not doing something for somebody else out of the goodness of your heart. It's doing something for somebody else with the consciousness that you yourself will need someone to help you. You'll be in that bed next. It'll come the time when you'll need the help of others. This is fundamentally the way healthcare works.
Hello, my name is Mary Sue Schwartz. I'm from Lansing, New York, and I want to talk to you about a problem I have with my insurance company, Aetna. I have had knee problems for about 10 years. I saw the physician. He recommended knee surgery. I opted not to do that, and instead of getting a drug which is injected into your knees, which relieves the pain and helps you to be more agile. My insurance company was denied this request because the first problem was they said that I didn't use the proper drug, the proper brand drug, which I won't get into, but on this paper, they're saying which two brands they would approve. So a month later, I get another letter saying that they're denying all treatment whatsoever for various reasons, which I won't go into. They said it's not necessary, fluid wasn't removed, etc., etc. In other words, they led me on to believe for 2 months that they were going to approve it. Later, they sent a letter they would approve it if I used a certain brand. Then later they said, the heck with it, we're not covering anything. So I was pretty much upset, and of course I am gonna, it's open season now for insurance. We're dropping Aetna, but we have been paying on the whole, the government and the private amount, $1,200 a month for this insurance, which denied a $3,000 coverage. So I'm pretty much health insurance companies in the future, they're cutting back and cutting back. As far as New York State goes, we need more coverage for the average person. It can't be health insurance for the wealthy, health coverage for the wealthy. It has to be, it's a human right, health coverage for all. And I strongly recommend that. And after my experience with Aetna, I'm pretty much discouraged about health insurances. Thank you very much for this time.
So we spend about 17% of all GDP. That means 17 cents of every dollar in this country is spent on healthcare, whereas these other countries spend about 8 cents per dollar. So it's not like this is a marginal difference. That's a lot of money. We're talking about trillions of dollars. Now, where is that money going? Well, the money is essentially going to private health insurance companies, private pharmaceutical companies. They are not about to give up that money.
The right wing has basically been very happy with the tactics that most of us have used till now about fighting for single payer. That is to say, they have marginalized this by saying that this is a left-wing radical idea. It's one that's promoted by people who are anti-business, who believe, that you want to do programs for the poor and disadvantaged, and that, this is a ridiculous idea.
My name is Charles Revis. I live in Castle Creek, New York. For many years now, I have been a strong advocate of single-payer healthcare. I've lived in the United Kingdom and experienced their single-payer system firsthand. I worked there for 6 months. At the time, I was a diabetic with hypertension. I've been a diabetic since I was 9 years old. Over there, all of my prescriptions, both insulin, testing equipment, testing strips, were all covered. You're not penalized over there for having a pre-existing condition. Instead, you're given a break. Unlike over here, where you may not even be able to get insurance for the pre-existing condition. In 2009, I began dialysis. My kidneys were slowly failing, partly due to the diabetes and probably partly due to hypertension. And I started at a UHS not-for-profit dialysis clinic. And then in, I believe, 2010 or early 2011, that clinic was sold to Liberty Dialysis, which was a for-profit company that was backed by Ignition Capital, Bain Capital, and KGR or KBR, I can't remember. Their portfolio read like a CIA wish list of front companies. Anyways, we were told, nothing would change, things would still be the same. But we all knew that things would rapidly change and services would go down, and that's exactly what happened, because you had a company that the vice president for the East Coast even admitted business model was to accept mostly Medicare patients, because when you go on dialysis, you have to apply for Medicare. Most patients didn't have secondary insurance. I did. And their business model was to try to get a profit out of a service life-saving service. People would be dead without it. They couldn't make a profit from the Medicare. So those few patients, which were about 15% of dialysis patients nationwide, that had private insurance, they purposely wouldn't get contracts and overbill the private insurance. So basically all the profit for 100% of the patients was being supplied by 15% of the patients. Anyways, this is not a good business model. If I went to a local bank and said this is my business model for making a profit, they would laugh me out of the office and of course deny me any type of loans. But yet these big businesses like Bain Capital will back them, and then they sold them. Last I knew, pending SEC approval, Liberty was selling this company to Fresenius, the second largest. This is not a way to provide health care to a nation. I think it's high time that this country joined the rest of the civilized world and had a single-payer healthcare system of its own. whether people want to look at it as a tax, I believe it should be a tax like the FICA taxes, and I believe it should be a progressive tax. I know a lot of folks will feel that that's unfair that they're paying for the sick, but in this country, we're only as good as the lowest among us, and although I'm totally not religious, I do believe that treating those people who have medical conditions or who have suffered great accidents shows to the rest of the world just how great we are. And right now we're not living up to that standard.
Trying to fit the square peg of healthcare into the round hole of a market system doesn't work very well, and America's healthcare system isn't working right now.
Hello, I'm Barbara Need. I live in Etna, New York. My health insurance issues actually relate mostly to my time in Chicago when I was working full-time. I had full coverage, then I was laid off. In fact, 2007, just before the financial crisis struck, and I was COBRA'd, but once I got off COBRA, being over 50, diabetic, high blood pressure, overweight, short, I was not considered to be a good candidate for health insurance. What I got was a limited liability, which I paid a lot of money for and didn't get very much from. And there had some problems getting some stuff covered for my health insurance in Chicago. I came here and I just didn't follow up. I needed to because of the diabetes and the high blood pressure, but I didn't do anything significant with it. Until actually I fell and broke my nose a year ago, October. And I had to pay, I'm still fighting with one of the suppliers about what is covered. My insurance company did pay, but they're saying, oh no, we're not going to recognize this, deal. I don't know what it is that the insurance companies do, but they have special deals and premiums, and so you aren't supposed to pay exactly what all of the $700 or some dollars, but they're not recognizing it. I now have good health insurance. I've got it through TC3 where I work, but it's very expensive because I'm only an adjunct. And on the other hand, I'm now seeing a doctor for my diabetes and my high blood pressure, and while things aren't where they ought to be, they are under control. But it's very frustrating that I have this problem, that I have nothing. Now I'm shelling out a lot of money every month for health insurance, and that could go towards buying a house even. So it's discouraging at times.
15 to 20% of what you pay to a health insurance company goes to administrative expense, including profits. By contrast, Medicare has administrative overhead of about 2%.
Hi, my name is Pam Goldner, and I live in Brooktondale, New York. I am co-owner of a busy cafe located in the lobby of a university library. We serve healthy, quality food and pay our staff good wages. We have 30 employees, 15 are full-time and 15 are part-time, and 2 owners. And we cannot afford health insurance coverage for any of us. The cost of an insurance plan that basically provides major medical care, has a high deductible and very little in the way of preventative care, costs about $5,000 a month for just the 15 full-time staff, and it would not include the part-time staff. And that is something that we can't afford. That would be about $60,000 a year, and we just do not make enough profit in order to be able to pay that out. Even if we paid half, which would be about $30,000, the employees would have to pay the other half, and they have told us that they just can't afford that. It's too big of a chunk out of their wages. And we really can't even afford the $30,000 and continue to pay back our business loans and continue to give staff raises. The staff, would still have to pay out-of-pocket expenses up to $5,000 before they reach their deductible. And it's not even an insurance plan that is really very helpful. The insurance companies, the healthcare costs are so high, and they just shouldn't be that high, and they aren't in any other industrialized country. Our insurance companies are not in it for the care, they're in it for the profit. As a small business owner, the cost of providing healthcare is too much of a burden, and I just don't make enough profit in order to be able to afford that. And these rates that the insurance companies are charging are so astronomical that they don't even go to providing healthcare. They go to providing salaries for the CEOs and paying the shareholders. This system is not sustainable and is going to be bankrupt soon. We need single-payer healthcare now. We needed it 30 years ago.
We're trying to get rid of an institution that is as American as apple pie as the private insurance industry. And what I think we have to increasingly explain to Americans is that this is actually a very centrist and mainstream and logical idea that is actually very strong for supporting American jobs and American families, that actually is sympathetic to the American business community, and that in fact it's patriotic to talk about single payer. Think about it. The economy, our jobs, and the national deficit are intimately tied with our ability to do something efficiently, more cost effective about our healthcare system.
Hello, my name's Alan Janae. I live in the city of Ithaca in Tompkins County, New York State. And I just wanted to say a few words about healthcare here in America from my perspective. Right now, I'm like a lot of other Americans. I don't have any health coverage because I don't have an employer that provides that. I don't have a job with health insurance. And this means that my plan for healthcare is essentially try not to get sick. And just to give you an example, the kind of thing that you don't do when you don't have health insurance is I had a loose tooth that was quite painful not too long ago, and it seemed to be getting looser and looser, and I just couldn't dream of the expense of going to the dentist. And I just couldn't afford to do that, and also pay rent and everything. So the tooth just fell out, and that's not an uncommon story, and it's just an example of how we don't really take care of people's health in this country unless they're lucky enough to have good health insurance. I had good health insurance at one point in my life when I was working for University of Connecticut, but even there, when my ex-wife was having our daughter, Vanessa, she had to travel more than an hour's journey to a hospital in Connecticut. I was commuting from Rhode Island to have the birth. So even with good private health insurance, you jump through their hoops. They set the rules. It's not designed to meet our needs. So I think we need to change that. We have to have national health care insurance here in this country that's available to everybody and takes care of everybody.
My name is Teresa Alt. I live in Collegetown, Ithaca, New York. Long ago, in the late 60s, early 70s, I studied Slavic linguistics at Columbia University, got a doctorate, prepared for an academic career, and in the following years discovered that that was not to be. There just weren't those jobs available. I tried translating. I rather liked it, Slavic languages to English, but translating is always, in a place like this, freelance work. So no health insurance. I reached the age of 40 and concluded it's just not safe to go on living without health insurance. So I said goodbye to my field and took a job as a secretary at Cornell and worked there for 6 years and in City Hall for 5.5, and did more clerical work after that, till I reached the age of 65, became eligible for Medicare, and was able briefly to resume translating, editing, and doing some of the things that I really had always wanted to do. Now, you might say that's my complaint, but it brings home a much broader point about the economy. This country is just full of people who are doing jobs that they don't want to be in, but can't get out of because the job is their only way to get health insurance. Sometimes it means that people are not working up to potential. Sometimes it means that employers are stuck with people who really hate the job but see no way out. If we had a single-payer system, a Medicare for all system, the economy would not be subject to this kind of distortion.
Norma Helsper, Ithaca, New York. This is my daughter, Lena. When she was 15, she came down with bipolar disorder. During her second manic episode, she had been up 3 nights. She was hallucinating. She was throwing things at the windows. She got out of the house and was walking in the street at night. And at one point, she tried to push me down the stairs. So we felt like we had to have her hospitalized. After she was in the hospital, our insurance company called every day to harass the doctor, saying, "This girl should not be in the hospital. She doesn't need to be in the hospital." Then one day when we were visiting her, I was standing close to her with my feet together. She turned around without warning and pushed me as hard as she could. She's strong when she's manic, and I went flying backwards. After that, the insurance company stopped harassing the doctor. But they called me a few days later and said that they were only going to pay a certain percentage of her hospital costs because they didn't agree that she should be in the hospital. Well, that was when I broke down, because through all this stuff, all this horrible, scary stuff, I had been strong. But I started to cry when that woman called me. And I think it's a shame that if I lived in France or Canada or even Cuba, I would only have to worry about the fact that my daughter has this horrible mental illness, and not about if I was going to go bankrupt paying for her hospital treatment. Now, a few months later, I got a bill from the insurance company, and they rejected the second few days of her hospital stay. Well, of course, I contested it, and I wrote to them that my friends at the National Alliance on Mental Illness told me that in New York there was supposedly a law saying that diseases of the brain were supposed to be treated on par with diseases of the body. And of course, they wrote me back and said, "Oh, on second thought, we'll pay this." But what really bothers me is that how about somebody that doesn't have the wherewithal to write that kind of a letter? They would just probably feel like they had to pay.
We are $16 trillion in debt. there are very few things that can bankrupt a country as robust economy as ours. One is wars that we do not need, and another is a market-based healthcare system that we've tried for 50 years, that a board of directors has told me you would fire me for advancing in plans for 50 years that failed as badly as this healthcare plan has failed this nation. And I think that it's time for us to start realizing that we have borrowed trillions of dollars to prop up this healthcare system.
I'm Savante Myrick, and I'm the mayor of the city of Ithaca. And when I was young, my mother raised the four of us, and we didn't have a lot. She was always working. She always had a job, but there were always minimum wage jobs, which meant that frankly, we were very poor. And most of her jobs didn't have insurance. Some of them did, most of them didn't. And that breeds a kind of anxiety that still lasts with me to this day. Even though I have insurance now, I have health insurance, I'm still anxious about going to the doctors or to the dentist. Not because I'm anxious about visiting the doctor himself or going to see the dentist. I'm not afraid of her when I sit in the chair. You know, I still have anxiety about when I walk out and when I walk to the front desk, you know, being able to pay for the care. That's something that has stuck with me my whole life. And the result is, you know, you can put off things for weeks or for months or for years when really you should get on it right away. Maybe the most dramatic example is I remember when I was about 16 years old. I was playing basketball and I broke my nose. My own teammate hit me with an elbow in the nose. And, you know, my eyes were watering, but I could tell something was wrong because everybody on the team went, ooh, you know. So the coach led me into the bathroom where I looked up and there was blood all over my face, blood all over my shirt, and I saw my nose was severely bent like this. And the first thing I said as I looked in the mirror was, well, there goes my modeling career, you know. And the coach said, okay, you know, at least you have a sense of humor about it. But we went to the ER and they recommended us to a bunch of folks who could fix this for me right away. The next day, a couple days later, I could just get it set. And believe it or not, nobody would take me or would take my insurance, the insurance that we had, except one guy. And this guy happened to be out on vacation. So we had to wait 2 weeks for me to get in. And by that time, the nose had set and it was deviated. So instead of just simply resetting it by hand, they actually had to break it again using pliers, and they broke it. And this time, instead of a fast, clean break, you know, it was more damaging. It caused me black eyes, and I had to wear a little mask on my nose, which made me very popular for a while. You know, it's that kind of experience that shows you that, you know, deferred maintenance is what we call it. When we don't do the necessary paving on our roads or the fixing of our bridges. When we defer our maintenance, our cost skyrockets later because the damage that's done is far more than was done in the first place if we had just jumped on it. Deferring maintenance on the human body and on human families is more than just immoral, in my opinion. It's bad economics, you know, to delay this kind of care, preventative care and treatment. Will, I believe, lead to higher costs down the road. And that's why I believe that, you know, we've got to find a way to get health insurance and health care for everyone.
Turns out that in the land of the free, your life comes with a pretty heavy fee. The cost of simple health today seems far too high to me. Imagine coverage for everything from fever to a birth. Imagine a world where everyone just pays what they're worth. Where life won't come to a hard stop when you break an expensive bone again. We gotta learn to provide for them and share the good earth. 'Cause people are people, like everything we bend and break. People are people, don't let let us die for money's sake, 'cause in the land of the plenty it's been decreed the sick will pay for a rich man's greed. But this is a country of the people, we know what we need. Imagine a world where healthcare doesn't have to be a threat, where doctors don't turn away the sick who are in debt, where treatment is a human right and not the concession after the fight. We need to keep that goal in sight. We're not there yet, 'cause people are people, like everything we bend and break. People are people, don't let us die for money's sake, 'cause in the land of the plenty it's been decreed the sick will pay for a rich man's greed. But this is a country of the people, we know what we need, because people are people, like everything we bend and break. People are people, don't let us die for money's sake. Let's make a future without the greed, where we don't have to hide it when we bleed. People are people, we are the people. We'll get what we need.